Okay, with that, we'll go into our weekly update of the COVID-19 with Kathy. You're all by yourself today, huh?
I lost my team. Good morning, Mr. Chair and Commissioners. I handed out the numbers that we do weekly. And as you can see, the positive cases as of the 28th were 6,123 for Clay County. We're at 77 deaths. Our 14-day case rate per 10,000 has been slowly going down, so we're now under 100, so that's good. Positive cases in Minnesota, 410,000. 13 newly reported deaths, so they're at 5,160 deaths across the state. And then, of course, the hospitalizations are there, 21,420 in Minnesota, and the ICU, 4,539 throughout the hospitals in Minnesota. The numbers for Sanford and Essentia, I mentioned last week, they were manageable as far as numbers of patients in ICU. And hospitalizations, they're not seeing a huge spike in those. They're seeing more cases in the emergency rooms, but not necessarily COVID cases. So that number, at least in our area, is not problematic. The second page, we're seeing, and this is as of December 23rd, so that's why there's a little bit difference in the positive cases, but from December 16th through to December 23rd, you see that the positive cases are not, they're really not going up like they have been. So we're seeing really much less number of total cases. So that's really been good to see in our area. We're not seeing the big surge of cases that some of the other parts of the country were seeing after Thanksgiving. And of course, we'll see now if we see any big surges after Christmas and New Year's, after the two holidays. We're hoping not, because we're thinking people are very diligent about following the measures. So that's really been great to see. Let me see if there's anything else about the cases. I can go on to, we have the, on page 3 and 4, we have the cases of, again, the age ranges of the cumulative cases, and then the age ranges of the active cases, which isn't really surprising. The active cases, though, as of the 28th, the big age range is the 20 to 24, and the 35 to 39 are kind of leading the pack there. And then we're seeing cases in the 40 to 49 range also for active cases. So it's across a little bit of the age spectrum there. I can go on to talk about our vaccine data. You see that there's vaccine distributed to Minnesota. So the total vaccine doses, 174,750 so far to vaccine providers allocated from CDC to Minnesota. And then so far, the number of vaccines that have been administered across the state, and this will change daily as vaccine gets out, but it's a little under 3,000 there that the COVID vaccines have been administered. Now, we're going by phases, so the federal and state health organizations have given us phases to go through. So as we provide vaccine, and you see in Clay County, there's been 143 so far that have received vaccine. Now, that would be through the healthcare system. We received some vaccine, and our priority areas, and I mentioned this last week, will be those that are vaccinating. So my nurses that will be providing the vaccination need to get the vaccine first, and then also the COVID testers, and that is that semi-permanent vault saliva testing site. We need to get those individuals vaccinated. So they are in our top priority. Those are the first ones that will get vaccinated, and we're already in communication with getting those to those individuals. And then, of course, our EMS folks across the county, we have, I believe, about 300 that will need to get vaccinated through the EMS. So those are first. It's phase 1, and it's the first priority in phase 1. So those are the 3 that public health will be vaccinating. So we'll be setting those up. We're getting another shipment in sometime this week, so we'll have enough to cover those EMS folks. And again, it's not mandatory, it's optional, so people can still say they don't want it in those priority areas. The nurses that are going to be vaccinating, they can refuse to take it if they want. We aren't mandating this vaccine, as well as the testers. We're hoping everybody will take the vaccine, but again, we're offering it. So we'll see. So it's the testers, the vaccinators, and then the EMS folks. The hospitals are doing all their folks, and when they do the clinics, they'll be doing those as well. So their healthcare systems, our long-term care facilities will be, the vaccine will be provided by the pharmacies that signed up to be providers. And so there's a number of other assisted living and other facilities that we are reaching out to that may have not connected with a pharmacy to get the vaccines. One of the long-term care facilities actually was authorized as a provider, and you maybe saw in the news that they're providing their own vaccine to their individuals. But most of the long-term care facilities are going through the pharmacies that have signed up to be providers.
The EMS people, do they have to come in to get it, or you go out to the different places?
We're going to work with them to see, we'll probably do a combination. So those that can come in, it would be great. And then if we need to go out to folks, we'll do that. We'll make sure we accommodate, and even schedules. We'll need to accommodate schedules as well. We're going to try to do the vaccines at least 3 times a week throughout the day, but we'll also accommodate after hours if they need that. We just need to get the vaccine out to them. So my nurses are ready to do whatever we need to. We have the appropriate coolers that we can provide we can bring the vaccine out. It'll maintain its temperature. There were special coolers for this Moderna vaccine. The one thing about this vaccine, they come in vials of 10, and in other vaccines, you can, take a few doses out of a vial, and you can maintain that vial for the next time you do vaccines. With this COVID vaccine, we cannot do that. So if we take 2 doses out of a vial, we need to use up the other 8 doses. You cannot carry it over till the next day. So that's going to be a little bit kind of managing those doses, because the big thing is we absolutely don't want to waste any doses, and we want to make sure we get it to the people. So, and try to maintain the priority areas. Minnesota Department of Health is pretty diligent about, until you get through that first priority, they don't want us to move to the second priority. So, but we're going to do what we can without losing vaccine. That's our priority, not to make sure we waste any.
Kathy, I have had several conversations with some school district members, and in terms of getting kids back to school, which I think is a big priority for not only the governor, but I think families as well. It seems that it would be wise to add teachers to that priority level because of the fact that before they were having trouble with teachers either getting it or being in quarantine, and so it was hard to get substitutes and so on and so forth. Where are teachers on the priority list?
Well, and thank you for that question, Commissioner Mojo. We had conversations as well with superintendents that requested that. The teachers are not in, so the first priority of 1A is those that I just mentioned. Second priority, we're still meeting needs for like dialysis centers, urgent care centers, and other healthcare facilities that haven't been met under priority A. And then the third priority under phase A is again pharmacies, mental health, behavioral health, correctional health, group homes. So teachers aren't in that first 3 priorities of phase 1. But we understand that need. We've talked with them about that. They may be in the next priority after the 3rd. I don't have the information about what will be next after this first phase, but I would hope we can get to them soon after that. We have to go, the phases are again made up by CDC and MDH, so we're not able to make those changes in who we think needs the vaccine, but we really understand that need. So we'll work with MDH on that. We've expressed it to MDH that our schools are asking for that. So maybe they'll hear us and make some changes about when we can get that out. Again, we're getting such small amounts through public health, and it may increase as we go along. So we're just working with kind of small numbers of allocations right now, but we certainly understand the need. And they really have phased where there's really high priorities of those that are at most risk for getting COVID or being hospitalized or in ICU. So yeah, appreciate that, that concern though. Any questions on the vaccine distribution? There's been a lot of training for even nurses that have to provide the vaccine. There's been a tremendous amount of modules that we had to work through. We also had a system that luckily enough we were able to secure in preparation for this, a system where we have to enter everything within 24 hours and get it uploaded. We purchased that through our CARES money. And then the Minnesota Department of Health came out with a system that we could use across Minnesota. Unfortunately, there's been some glitches in their system, so we're not able to use that system. So we're very fortunate to have the system we have that we can use. So we're not going to use that Minnesota system because it's not available. So we'll be, as we start our vaccines, we'll be using the system we have purchased, and the nurses have all been trained on that as well. So lots of training happened to get prepared for providing this new vaccine. The COVID testing site we've seen a decrease in the number of people getting tested the week of December 20th. And we suspect, there's students that are gone and other folks. So it was 2,800 the week of December 20th that were tested. But we expect that to ramp up as higher ed comes back. They'd like to utilize the testing site, and so would some of the folks through K-12. So I'm expecting we'll get, there'll be some ramp up in numbers of people tested.
Sure. Oh.
I was just going to ask if you have any idea how long that testing site will stay. I know there was some discussion early about it only lasting until the middle of December. Is it still a week by week type situation?
Right. Minnesota, I asked the question. Minnesota Department of Health does not have a specific date where they think they'll close down, but right now they're functioning, and it looks like they plan to function for, we hope, a couple months, but they're not sure, depending on, they utilized funding to keep them operational, and then of course if they can bill insurance companies, they're getting more revenue to do that testing as well. So we haven't heard anything about them closing across Minnesota, so that's great. We've heard a lot of good reports about the testing site. And in fact, some of the schools, they can order the testing sites to be mailed. They prefer to go to the saliva testing site, the majority of them. So it's going to be utilized quite a bit, we think, in the next month. So no word on any specific date that they may close. So we're hopeful that they'll stay open for a while.
Which is the next closest site then to Moorhead for testing?
Well, the Fargo has a testing site. Actually, it's located in West Fargo, and that's a swab test Monday through Friday, and then, of course, testing through the healthcare systems as well. And then Minnesota has the ability to order those home test kits.
If you live in Detroit Lakes, so you get tests to come to Fargo Moorhead for that?
They might come to our saliva testing site, or they would do the home test, or they'd test through their healthcare systems there. Other questions that you may have about numbers, testing, vaccine?
Very good, Kathy.
Okay, thank you
See the
very
numbers are
much.
Coming down.
Thank you.